Hello, this is Dr. Marcel William, Professor of Internal Medicine, Gastroenterology and Hepatology Unit at Ain Shams University. Our topic today is autoimmune hepatitis. By the end of this lecture, you should be able to describe the clinical presentation of autoimmune hepatitis, suspect the diagnosis from symptoms and signs, propose a diagnostic workup, and devise a treatment plan and follow-up of the patients with autoimmune hepatitis. Well, as its name implies, autoimmune hepatitis is hepatitis due to breakdown in immune tolerance, mostly seen in young women, and the cause of which is unclear. The clinical presentation of autoimmune hepatitis, as shown in these two slides, will be discussed in the face-to-face session. Onset is usually gradual, including all these symptoms, and the signs of chronic liver disease can be present. In about 25% of patients, the onset is acute, resembling viral hepatitis, but resolution does not occur. And the acute presentation can lead to extensive liver necrosis with acute liver failure. Associated autoimmune disease such as Hashimoto's thyroiditis or rheumatoid arthritis can be present. If autoimmune hepatitis is suspected, the following investigations will support the diagnosis: high levels of serum immunoglobulins, especially elevation of IgG, presence of autoantibodies, most frequent high titer of anti-nuclear antibody and anti-smooth muscle antibodies. The presence of anti-liver kidney microsomal antibodies, anti-LKM, is typically seen in the pediatric population. If the diagnosis of autoimmune hepatitis is suspected, liver biopsy should be performed to confirm it. It typically shows interface hepatitis with or without cirrhosis. Now, how these patients are treated? Well, corticosteroids is a life-saving measure in autoimmune hepatitis. The dose is generally reduced as the patient and the liver function tests improve. Then maintenance therapy should only be instituted once the liver functions are normalized, as well as the IgG if it were elevated. Reduced dose prednisolone, ideally 5 to 10 milligrams per day, is given together with azathioprine. Patients should be monitored for acute exacerbations, and liver function tests, the IgG screening is done. This is discussed in the face-to-face session. Although treatment can significantly reduce the rate of progression into cirrhosis, yet end-stage disease can be seen in patients despite this treatment. Please be ready with your questions in the next face-to-face session.